I'm Scott Loughlin. This is the Data Chronicles, and here are your data points. Today, we are discussing updates in US AI laws that are particular to the health and life sciences sector. While AI is governed by many laws, there are a growing number of specific laws that are designed to regulate AI in particular. And not surprisingly, that number is growing in California versus other states. Most of the statutes emerging outside of Colorado are not broadly applicable and thus are dissimilar to the EU AI Act. Instead, they are focused on more specific problems, use cases, and signal that, frankly, the US may continue its historical pattern of creating a piecemeal patchwork system of specific regulations that apply differently depending on sector, use case, data, regulated entity, and so many other factors. And as a result, this trend, this theme that we will capture today, will have much broader application than just the health and life sciences sector. So if you don't spend your days in that space, please stick around. There's a lot to learn. I want to also add that this episode is a continuation of our AI Mastery series, where we teach aspiring AI lawyers all about the legal issues impacting AI. We have a bunch of great content about so many different areas of law and how those areas of law are responding to emergence of generative AI and other AI technologies. Check them out. So with that, let's jump right into California and the new AI laws that will go into effect. To discuss the flurry of AI legislation in California in late 2024, I've invited two of my colleagues, Jessica Robinson Hanna and Alyssa Golay, to the podcast. Both Alyssa and Jessica specialize in the health sector from both a compliance and data perspective. So I'm so grateful to have them on the show with the opportunity to share their insights with a larger audience. Alyssa and Jessica, welcome to the podcast.
Thanks, Scott.
So, Jessica, maybe I can ask you to get us kickstarted, because I really want to focus in on these three new laws that are going into place with the specific focus on AI and health. I know there were a number of other laws that went into effect in California at the same time, which we can cover in super episodes, but these three have a common theme, and that is healthcare, life sciences, sensitive data, and all of which I think are going to be of particular interest for folks who follow this space and also who are in the health and life sciences communities. So let's start with, I think, what is called as AB 3030, which focuses on patient communications. Can you give us a sense of what this law requires with respect to AI?
Sure. As you said, yeah, there was a flurry of AI legislation at the end of the legislative session here in California, and there were a few bills. AB 3030 is maybe one of the simpler ones, and so it simply requires that a healthcare provider that is using generative AI to create patient communications that relate to patient clinical information, those communications have to include a disclaimer, basically a forward disclaimer or something simple like that says this communication has been created with the use of generative AI. And something that you'll see throughout these three bills we'll talk about today, or at least through the two I'll talk about, is that there's an exception in the law where a clinician is directly involved in sending that communication. And so the requirement to include the use of generative AI disclaimer does not apply if an actual healthcare provider has read and reviewed the communication before it goes out. So there is that exception. But for information that is sent without an actual healthcare provider reviewing it and reading it, everything else that is created using generative AI and that pertains to patient clinical information needs to have that use of generative AI disclaimer on it. So a simple marketing communication wouldn't have to, like, say, for example, a healthcare provider office does Botox and they're sending an email to their patient list that doesn't involve any patient clinical information and simply markets the availability of that Botox, that would not need, and say also is created using generative AI. That would not need to have a disclaimer. The requirement pertains only to those communications that include patient clinical information. And I think, just to clarify, I know I may not have fully addressed this at the outset, but the requirement pertains both to those sorts of email communications I mentioned, but also to verbal patient communication. So even if the communication is initially drafted or generated using that AI and then communicated verbally to the patient, you would still need to include some sort of a disclaimer.
I mean, it's interesting because it sounds actually kind of rather complicated to know when it is you have to include this disclaimer and when it's not. So let me just go through a couple of examples and you tell me yes or no that I need to include it. So if I have an office administrator who is without the review of a doctor using generative AI to send out a blast communication by email or by physical mailing, telling individuals that it is flu season and it's time to get their flu vaccine. Do I have to include that or not?
I think I would say no, but a note I would apply here and throughout is it's going to be important to see what sort of guidance is issued in the state and if any implementing regulations come down the pike as well. But for now, where we don't have either of those things, I would construe that to be an instance where you don't need to include the disclaimer because there's no specific patient information going into that communication. It's just, this is the service we have available and, consider coming to us for that service.
Right. And that would be different than, let's say, there was sending a same communication but it's flu season and it looks like, that the flu is targeting individuals between the ages of 18 to 35 and they're at high risk for flu this year. And so the office administrator reviews their patient roster and they say, let's send this communication to patients 18 to 35 as opposed to everybody, because that would be the use of patient information. It wasn't reviewed by a clinician, and that is then needs to include this disclaimer.
Precisely. Absolutely. Or, carrying on that. For example, if the office administrator looks at their records and they can see that you personally, Scott, have not received your flu shot yet. And the message goes out, you haven't received a flu shot yet. You should come in. Like that would also need, assuming that message is generated using generative AI, then yes, that would need to have that disclaimer.
Yeah. I mean, interested, and maybe I'll ask, for each of these laws, the interesting thing about AI and the way that we're trying to regulate AI, and the theme of this podcast has been around, why are we creating these laws when we have a whole bunch of existing laws that apply equally to AI as like any other types of technology? So what harm are we trying to address here? What is the purpose of including this disclaimer, which applies maybe some subset of the time for patient communications?
I think maybe in this circumstance, given the exception for instances where the communication is reviewed by a physician or a healthcare practitioner, I think the thought is that people may think when they see a message coming from their provider's office that this is a message from my doctor. And I think that gives a message a level of credibility. And so I think this is intended to address instances where it's a fairness thing, like the patient should know that this is not actually a message from my doctor. My doctor is not telling me I need to come in and get Botox or, whatever, that it's not. It's a message that was simply created through the use of generative AI and my physician didn't sign off on it. At least it doesn't carry any implication that the physician signed off on it unless they did.
Yeah, really interesting. Maybe we can turn from AB 3030 to Alyssa. Maybe we want to talk a little bit about what I think is referred to as AB 2013, which focuses not necessarily on transparency surrounding tagging messages that have been written by generative AI, but instead focuses on the training data and actually kind of new and interesting ways. What was 2013 about?
So AB 2013 requires AI developers of generative AI systems and services, or those that utilize existing models in a substantially different way, and that make these models available to Californians after January 1st, 2022, to post information about the data that was used to train those AI systems and services. And so this comes into effect, and you'll have to post those notices if this applies to you by January 1st, 2026. So we've got a little bit more time than with the previous previous law we were just talking about, which goes into effect in January of 2025. But this really focuses on providing more transparency around what data was used to train those AI systems and services. And so this highlights the concerns by regulators and others that people's personal data or other kind of proprietary information or IP protected materials were being used to train models without people's knowledge or awareness. And so this is then requiring those developers to post in a way that others can see, right? Specifically what data was used, not down to like the specific data element, like Alyssa Golay's information was used to train the system, but rather the categories and types of data that were used, the time period from which this data was pulled. So that kind of leads towards, are there issues or concerns or potential biases or inaccuracies in the data itself that were used to train these models? Or, on the flip side, can help show that the data sets that were used to train these models are actually very robust and can help support, more accurate outputs.
So, I'm very curious on this law because obviously this is a new kind of way of trying to think about how to address AI, again, through, I guess, a transparency-oriented model. You're describing and telling everybody about what data you used. I guess first question is, you said it didn't have to be at a Alyssa Golay level or a Scott Loughlin level. It can be more around the categories and types of data. We can describe categories and types of data very differently in different levels of granularity. What is expected, or what does the law require, maybe I should say, around how specific that disclosure needs to be?
The law itself lists out several specific elements that would need to be in what they call a high-level summary of the data sets that were used to develop the AI system or service. And so it includes the sources or owners of the data sets, a description of how the data sets further the intended purpose of the AI system or services, descriptions of the types of data points, and then further kind of defines this to say this could mean the types of labels that were used for these data points, or if it refers to general characteristics. It also includes specific disclosures about whether the data was protected by copyright, trademark, patents, or whether this was entirely public information, or whether the data sets themselves were purchased or licensed. So it's not just about the data types and specific elements that are being prescribed by this law, but also kind of those data sets and sources and origins of the set more broadly.
One of the aspects here that it's almost like this law is assuming is that we're not leveraging some large language model, which has been produced and integrated with from a third-party provider, which was using its own data, likely kind of all data on the internet. And so the question here is this only around like first-party AI development, that if I created a specific AI application that I use my own data to train, that's the disclosure I need to produce? Or are we talking about, I'm a hospital system in the state of California and I license in an AI solution, which itself was a combination of a number of other AI solutions that I have to now disclose their training data?
So this law, unlike some of the other bills that were proposed, such as SB 1047, which was the Safe and Secure Innovation for Frontier AI Models Act. So that was like the big one that caused a lot of concerns because it was specifically targeting those, very large language models. Think the ChatGPTs, the Gemini, the Llamas, those types of big first-party LLMs. There were requirements within those laws specifically that looked at, the compute power of those types of models to say you are in or out of scope of these laws. AB 2013 is broader than that. And so it doesn't go into that kind of size limits in terms of who it would apply to. So it would apply potentially to those health systems or others in the healthcare context who are leveraging a first-party model, but then making substantial modifications to that AI system or service through their own additional fine-tuning or training of those models. And so I think the law appears to recognize that you may not have insight into all of the data that were used to train, the initial model, but to the extent you are then substantially modifying it for your own particular use case, then you do need to be transparent about what data is being used to modify the data and train it in that context. And then additionally, right, you get some knowledge under this law about what data was used to train the kind of initial model that you then modified.
So in the end, we're having, these organizations produce summaries of the types of training, data that they were used to train their algorithms and their AI-based solutions at some level of generality, high level description, whatever it is. What benefit is the legislature expecting out of this requirement?
So I think the key benefit is increased transparency and awareness about how these models are being trained and developed so that individuals or agencies and other organizations can hold them accountable, right? Make sure that they had the appropriate permissions to use the data in the way that they are currently using them. As the FTC loves to say, there's no AI exception to existing laws. And so I think this is another way of the California legislator making that note and kind of putting companies on the spot to say, yes, I had the appropriate permissions to use the data that I am using to train and develop these and improve these technologies. It also then, kind of in addition to putting them on the spot and holding them accountable, requires those companies to make sure that they are documenting and aware of what data is being used to train their models, right? So they have to be more thoughtful and document on the front end and kind of throughout this process, right? What data was being used, what time periods they were evaluating, and the like. And these are things that a lot of these organizations have already been thinking about, but here it's kind of putting out clear expectations of these are the specific types of information and documentation that we expect you to have and be able to put forth in these notices later on. Since earlier on, this year and in the past few years, companies have been a bit unsure of what is required or what to expect and what all documentation they need to have ready for regulators or others as this technology quickly evolves.
So Alyssa, I think I hear you saying two things. First is this law really underscores the importance of having a governance process, and with that focuses on essentially the accountability prong of AI governance, creating that documentation which would later be used to demonstrate how the technology was developed and how it's being used, and then be able to suss out, areas where any inaccuracy or safety issues or bias or any of the many other things that can go wrong first was created. So that's kind of all that item one. Item two seems like it's like the gotcha objective, like, oh, hey, I gotcha that you were using my data without my permission, or you used, my customer data in violation of our contract, or you used our consumer data that was collected through this particular privacy policy, but the privacy policy didn't accurately describe that you're using it for AI. And is that a fair summary?
I might go so far as to say the legislators, right? We're trying to pull a gotcha on organizations who are developing this. I think rather they've seen, and expressed concern over organizations potentially misusing data or consumers and, the public not being aware that information that they had shared or provided to organizations then being used to train and develop, all of these technologies that have been commercialized or used in different settings. And so it's kind of helping to put them on notice and reminding them that, hey, this is a key part of our existing structure and kind of governance and accountability and transparency that we have in society, that you need to make sure that people are aware that you are using their data for these purposes and, you are complying with your legal obligations.
So, Alyssa, I mean, that's really interesting. Maybe at this moment, I'd love for us to turn our attention to the third law that I wanted to cover on this show. And Jessica, maybe you can help me out here. This one I know is referred to as SB 1120, and it applies uniquely to plans, to insurers. You'll help me understand exactly who, because I think it get kind of complicated quickly.
Yeah, yes, absolutely, Scott. So happy to help. SB 1120 applies to issuers and state regulated health plans in the state of California. It basically layers on top of existing laws that govern utilization review and management, which is basically when a physician determines that a patient should have a certain healthcare service or a medication, a plan, in some cases, requires review and approval of that before the patient can receive that service or prescription. And there are guardrails around that exist already. For example, sometimes those reviews have to occur within a certain amount of time, especially if it's like an urgent service. So this layers on top of that certain guardrails and limitations about the extent to which AI and algorithms and quote other software tools can be used in the context of utilization management and review. And so basically the law, among other things, sort of looks at what's been happening at the federal level, because there were similar restrictions enacted by the Centers for Medicare and Medicaid Services in federal regulations that took effect early in 2024. And so this implements those restrictions in California, but also goes a little bit further, I would say, in terms of implementing certain guardrails. And if it's helpful, I can go a little bit more into detail. Specifically, I think the most important restriction we're seeing, because we know health plans are using AI algorithms and quote other software tools every day in this sort of review. It's, necessary based on the volume of these reviews that are happening. It would be incredibly onerous to have individual humans reviewing every single thing. So the question is, when these issuers and health plans are setting up their programs to conduct these sorts of utilization review and management decisions, like which portion of that can happen using the algorithm, the AI, the software tools, and which portion of that has to be conducted by a human, and then of that subset that has to be conducted by a human, which portion has to be conducted by like a physician that is trained in the specific type of service that is being requested. And so this law says that, where the utilization review or management decision is based on medical necessity, that has to be made, the ultimate decision has to be made by a physician. The law doesn't say that AI can't be used at all in that review. So AI could certainly be used, perhaps to make a suggestion to a physician, but then the physician actually has to look at the output of the AI or software or other tool, and then make a final decision. So ultimately, when you're a patient that your physician has recommended a service based on your individual medical need for it, that that under this new California law, a physician will be making that ultimate decision, even if AI is involved in an initial review of your chart.
So maybe an example could help me understand how this would work in practice. So if I am a resident of the state of California and I have insurance through one of these governed entities, which sounds like it's many plans, but not all plans that help and service the California market. I am out on a Sunday afternoon playing pickleball, and I injure my knee, but the scope of my plan means that and I say, hey, I really need an MRI because I think I tore a ligament, and my plan says, well, MRIs are expensive. Why don't you go through 4 weeks of physical therapy to see whether that addresses your issue before we give you permission to go to get your MRI, which then could result in a surgery, which is even more expensive. That would be the kind of utilization review that this law says you may be able to leverage some components of AI, but you also need to have physician involvement in making those important decisions about who gets access to what types of care.
I think that's exactly right. Yes. So in that scenario, not only would a physician have to review your specific request, but the law says that it has to be it's a PA, it's a healthcare professional. So it may not actually be a physician, but a qualified healthcare professional that is competent to evaluate the specific clinical issues involved in the service that is being recommended for you. So it couldn't be a dentist reviewing your request for a knee surgery. And the other, I think, important wrinkle is that the law would require the decision on your care to be based on your individual medical clinical history, right? So an AI may say, most people who have these symptoms don't actually need surgery. But in California, under this law, you would also need to take into account like any clinical history that you have, perhaps you've had 3 other injuries to that knee that make it more likely that you individually would need to have surgery in this case. So yeah, so the law would require that before that your request for surgery could be denied for medical necessity reasons, basically before the plan could say you don't need this, it would have to be the decision. If AI is being used, then the decision would have to be ultimately reviewed by a competent healthcare professional, and it would also, the decision would have to be based on your individual medical history.
Yeah, I mean, really interesting. And what strikes me about this law is that the rationale for it is perhaps more clear than the other two that we just summarized, including that, inaccuracies in the way that this tool would be leveraged could result in all sorts of safety and bias issues, for individuals who may themselves no longer have access to what could be life-saving care. Like, for example, you have an AI tool that is, for whatever reason, unintentionally denying a request for cardiac surgery for this subset of population, and all of a sudden that group, all has heart attacks. Boy, isn't that like something that we would want to get out ahead of?
Precisely. Yeah. And I mean, I think we all know, we who've been working in the AI space for a while, we know that some of the data sets upon which AI is developed are biased. And so you certainly wouldn't want to have your healthcare decision making be based upon, say, a completely unrelated data set. So, I'm sure if people under the age of 21 get a knee injury, maybe they heal faster, maybe they don't need surgery, but people our age maybe do. So so it's basically just ensuring that if AI is being used, the issue in the law, it remains to be seen. We will expect the agencies that are tasked with administering the law will issue some guidance, because there are some ambiguities in here. Like, for example, the term quote other software tool is not defined. So we'll have to see. And there are some other ambiguities, like, for example, the use of the AI software or other algorithm cannot quote cause harm. And it's hard in the context of where, like, inevitably healthcare services are going to be denied, or maybe a lesser service will be requested or approved, or a different service will be approved. Like, potentially people maybe are harmed in that. And how do we know? I mean, how it may be difficult to discern what harm is directly related to the use of the AI. But so we'll have to watch this closely as this is rolled out, and how the California agencies address those sorts of ambiguities. But I think generally you're right that the concerns we're trying to address here are just, concerns about bias and ensuring that, healthcare decision making. I think the drafters of this legislation acknowledge that there's a lot of good that can come out of the use of AI, but they wanted to ensure that there are just common sense guardrails, like those that require people to look at your actual medical history, and that a qualified medical professional makes that final decision.
And this fits into a broader trend that we're seeing. So this is similar to some updates and guidance that CMS issued that went into effect of January of this past year, where they don't want to, prohibit or ban the use of AI in the healthcare space. Regulators and legislators recognize that there's a lot of good that can be done in this space, but they want it to be done responsibly and thoughtfully, and in line with, quite a bit of oversight. And so this really focuses putting, a human in the loop for reviews when there is a potential for, increased harm or higher risk circumstances.
Yeah, and that's really interesting, because it seems like there's a bunch of the principles that are in play in SB 1120, right? I've heard, areas of, Alyssa, to your point around risk assessments, and in particular, this probably being a high risk issue, especially to the extent that automated decision making is implemented. There's aspects of safety here. There's aspects of bias. There's obviously aspects of accuracy, but importantly, what we're basically saying is that human oversight is going to be the key to the leveraging of these tools for these more sensitive purposes. Again, a broader trend that we see in all of these emerging frameworks. So maybe, Alyssa, I would ask you, perhaps from your perspective, is, if you're taking a step back from each of these three laws, do you see any common themes that these laws fit into the larger AI policy making, AI related debate that obviously is focused on sensitive data, but not entirely on sensitive data, looking at things more broadly across the board? Interested in your perspective about how these three laws fit in that larger framework.
Yeah, these three are a good example of some of the key aspects that we're seeing in regulations, more broadly across the US and at the state level that are being proposed, as well as the kind of discussions at the federal level and guidance and enforcement actions that are coming out, right? And this is a focus on making sure that you have some AI governance controls, right? A process for being aware of what AI tools you're using, how that data was trained, where it's being deployed, and making sure that that is done in a responsible, accurate, and fair manner. There's also the key aspect of transparency, right? Making sure that your users or consumers, those whose data or lives may be impacted by the use and development of these tools, are aware that they're being used or that their data was used to train this, right? So that you can have accountability for the outcomes of the uses of these technologies.
Yeah, I think that's exactly right. And while these are three of several that went into effect, or at least were enacted over the fall period in California, we're not expecting these to last in California nor at any of the other state laws.
That's exactly right. As we've seen with California legislation, before with the CCPA and CPRA, California likes to push the boat out in front, and then we see other states following. And we've seen similar laws being proposed in other states that look at, requiring disclaimers for chatbots or uses of AI in certain contexts, even going a bit further in these utilization review requirements than California, in requiring certain algorithms to be submitted to a Department of Health or receive some other oversight, but really a lot of focus on having a human in the loop in higher risk circumstances, making sure there's appropriate documentation, risk assessments, and transparency over the use and development of these tools more broadly.
Right. But importantly, what these laws do not have is a comprehensive approach or strategy in ways that perhaps maybe the CCPA and some of the follow-on laws that followed the CCPA did.
Colorado's the only one that's so far at the US level that's done a more kind of comprehensive AI law that mirrored more of the EU AI Act and took a risk-based approach. Again, still different, and that one may be subject to some changes, but you're exactly right. California is taking, unlike the CCPA, a more kind of industry-specific and use case-specific approach, although they signed a bunch of laws in September, so there's a bit of a patchwork going on there as well.
Alyssa, I remember as a kid, I used to sit in church, and one of the things that I was allowed to do was to have a connect your dots game where I would try to, navigate through this maze by connecting dots. To me, it sounds like that was early training for AI law going forward, because we're having to have so many of these different areas, all of which have different and important policy themes that cut across all of them, but also ones that look very different from one another. And it's our job to navigate that morass or that maze.
Exactly right. Hopefully, like your games from church, it turns out to a nice, picture that covers the appropriate places that we need to. But it's definitely going to be quite a path to chart and figure out in the meantime.
So I really appreciate the insights from each of you. Thank you so much for sharing them, not only with me, but our larger audience. And hopefully we'll have you both back on the podcast to talk about future developments, not only in the health and life sciences space, but also within the larger community.
Thanks, Scott.
Thanks, Scott.
With that, I'm Scott Loughlin. This is the Data Chronicles, and those were your data points.